From Albany County's perspective, we have found that the consumer-directed personal assistance program has been a real important tool in the delivery of services to people who are in need of personal care, home health care, or long-term care services at home. It helps maintain someone in their own home, while at the same time provides a flexibility in the services that are delivered at home based on the individual's need. They have a greater opportunity to flex their services based on even on a daily need because of the way the program is designed. That flexibility provides greater independence for an individual residing at home.
Initially, what individuals do is they call our Albany County New York Connects line, and they discuss the need for services. And their discussion surrounds around the Consumer Direct Personal Assistance Program. They're asked if they're already established with the Medicaid program. If they're not, we ask them to get established with Medicaid first. Once that's in place and their eligibility has been determined, then they actually fill out a consumer application. The application asks specific questions to determine whether or not they're actually self-directing and whether they can actually hire, train, and supervise their own staff. It gives us an initial feel for the individual's ability to be consumer direct and self-directing. So at that point, once we get the application back and it's reviewed and we've determined that they are self-directing, then we can go out and we have asked for doctor's orders. It's a requirement of New York State Department of Health to have doctor's orders in place. And we'll go out and do an assessment with a nurse. It's both an Albany County Department of Social Services caseworker as well as a nurse who will go out and do an assessment utilizing the state required Department of Health forms. The process usually takes about an hour or so. And there's a lot of questions that are asked, both medical and social, so it can determine what kind of services an individual is looking for under the consumer direct approach.
We're able to assist a family who has a child, a young child who has a high level of care need, where the family has needs for their to deal with the other members of their family, where we come in and provide services specifically for that child, or say a young adult who is employed and has needs to be able to get out in the community to go to work, or wants to go out at night where the non-traditional hours, where an agency might have some difficulty providing those services. This model provides a greater flexibility and greater availability of people who might be able to be trained and directed by the consumer to provide for his or her needs at home. Yes, in Albany County, I think there's a very clear example of his success is in the non-English speaking population within Albany County. Mm-hmm. Traditional home health care model many times has a difficulty in supplying aids that might be able to meet the language needs of our diverse population. In Albany County, we have certain areas with concentrations of individuals who have different ethnic backgrounds and language needs. They are able to now, through the CDPAP program, access services or service help through individuals who speak their language. Many times they are members of their own community. They feel comfortable with that individual, and therefore we're able to get services in that meet the needs that were assessed and provide a certain comfort level for the consumer to have someone who can speak the language and are aware of their customs, and therefore we find that people are much more pleased with the delivery of service in that model.
Great. Older adults, families with children, what kinds of cases do you see this program being used with?
The whole spectrum. We're able to assist a family who has a child, a young child who has a high level of care need, where the family has needs for their to deal with the other members of their family, where we come in and provide services specifically for that child. One of the things that we've noticed is an increased demand for the program as people have become educated about the program and the way it operates. Right now in Albany County, approximately 44% of our service caseload is through CDPAP, and we see that growing every year.
People want to be able to have more flexibility and have the option to choose how they're getting their services. And as they become more aware of the ability to be able to have that opportunity to do that, they've become more inclined to request that service, and we can continue our education and outreach to encourage others to do the same.